Essential Self-Care Podcast, a podcast for those of us who are, let's face it, too busy for self-care. In this podcast, you will hear real life stories from people who leaned into their self-care as they were navigating life's storms. You'll learn practical tips, tools, and strategies to incorporate self-care into your own busy life as well. You'll hear from expert guests sharing their expertise on specific tools and modalities of self-care to optimize your well-being in your life, career, and relationships. I'm your host, Dr. Sheetal Ajmani. I am a physician, best-selling author, and founder of Radiant Living Institute, where I guide high-achieving women to get unstuck and learn to live radiantly again through major life transitions. Quick disclaimer before we dive into the episode, please know that this podcast is for educational purposes only and is not medical advice. Always seek the advice of your own health practitioner or mental health provider for your specific situation. Now, let's get started. Welcome to another episode of the Essential Self-Care Podcast. I am excited to be in the podcast studio today again with my friend, Dr. Meghan Karol. Dr. Karol and I met close to a year ago. I was offering, I was offering some yoga classes specifically for folks in the healing professions, and she came to one of those classes, and that's how we first met, I believe. And we have kept in touch since then. I love the work that she's doing, and I think it's very important work for us to talk about. And so that's why I'm really excited to have you here today. I will do a formal intro, but real quick, welcome to the show,
Thanks.
Meghan.
I'm excited to be here too.
So I do want to kind of give the appropriate reference of your credentials here before we dive into the conversation. So Dr. Meghan Karol is a doctor of physical therapy. She specializes in pelvic PT. So she works with clients at Movement is Medicine PT in Norfolk, Virginia, as well as the Juniper House in Chesapeake, Virginia. So pelvic health physical therapy, she is going to describe more about what it is. But real quickly, it is specialized care that focuses on the muscles, joints, and connective tissue of the pelvis to address any issues that impact the structural support of pelvic organs, bladder and bowel function, and sexual health. Common pelvic health conditions treated using pelvic PT include urinary leakage, pelvic pain, tailbone pain, pregnancy-related pain, and postpartum recovery. So there is a lot in there. And, you know, Meghan, one of my intentions with this show is and always has been to have some conversations around topics that we don't necessarily always talk about, but that are really, really important and that we need to be having discussions about. And I feel like some of these issues that I mentioned, urinary leakage, bladder dysfunction, things affecting your sexual health, these are all things that a lot of women can feel maybe embarrassed to talk about with their friends or family, or like not even really maybe know who to talk to about it, or when they're experiencing the symptoms, who to ask, like, is this normal? Is this not normal? Should I seek further evaluation? Like, is there even anything out there to help me with it? Right? And that's why I wanted you on this show. So what is pelvic PT and why do we need it? Why is it important?
Yeah. So yeah, you hit the nail on the head. Like, these are not easy things to talk about, or, because we're kind of taught about, like, don't talk about bathroom habits. Don't talk about your sexual, life. Don't talk about those things. If you are brave enough to say, hey, I leak when I sneeze, unfortunately, sometimes the medical system is like, well, that's what happens after kids, or, well, have a glass of wine and just try to relax, and enjoy it. And sometimes that's misguided information or out of date information. And it's like, no, there really are muscles there, and the bony pelvis and all those things, and the way that functions during day-to-day life can be helped and treated. So if you were having shoulder pain when you picked up your groceries, no doctor would be like, you're fine, just muscle through it. No, they would be like, well, there's a whole profession that can help you with that. But again, sometimes we just forget about the muscles in the pelvis. Some people don't even realize there's muscles in the pelvis. So again, sometimes people just don't realize that there is a subspecialty within physical therapy that can help out with all those functions. Bowel and bladder control, sexual health, even support stability. So our core stability includes the pelvis.
Well, that's great. Thank you so much for that. And you did bring up a lot of great points. Yes, some of those issues, yes, I think even for men or women are difficult to talk about. And so for this episode, we are going to focus more on some of these women's health, women's pelvic health issues. But I am curious, so within your practice, do you also work with men and children, or are there other pelvic PT specialists that would focus specifically on those areas, just for any men listening or women who have men and children in their life who may be navigating some of these issues?
So men's health and pediatrics is not within my education that I've done. Maybe in the future that will be added on, but right now I have been focused more so on that women's health. So happy to kind of help someone connect with a provider that can help with them. I have seen two, but they weren't having any penile issues. So I was kind of like, all right, a bladder issue and a rectal issue. And I'm like, those are within my scope in my education, even though the anatomy is slightly different. So, kind of caveat to that, like I would help someone through it unless it was like a penile issue. And then I'd be like, I haven't taken that coursework yet.
Sure. Great. Thanks for that clarification. And it is good to know that there are specialists out there if that is something that one of our listeners are, that some of our listeners are facing. So let's go back then to women's pelvic health and pelvic PT, why we need it, why we need to know about it. You did describe, there are some things that we maybe think of as kind of quote unquote normal after childbirth, but that there are actually things that we can do to help with it. But then you also mentioned that a number of your clients have not had children and need it for other reasons. So can you go over kind of some of those reasons that we would need it, what it is, what that looks like?
Yep, absolutely. So kind of, I like to think about like the 4 functions of the pelvis and then kind of where you would need help if any of those things are going awry. So certainly sphincter control. So, again, controlling bowels and bladder. We want to hold it in when we want to hold it in. We want to release it when it's the time and appropriate place to release it. So you're having any issues with that control. Having sexual health. So again, being able to appreciate touch, being able to appreciate penetration if that's a part of your sexual experience, allowing for those things to happen without pain. Sphincter stability. So again, I kind of mentioned previously that our pelvis and our pelvic floor is a part of our core stability. So sometimes we overfocus on the abdominal muscles and we don't think about those pelvic floor muscles. So if you're having even low back pain or hip pain, sometimes can that missing piece be that pelvic component? And then for some reason, my other S is like flipping around my head, but it will come back to me here in a second. Sphincter, sexual stability, and something. I will come back to that. But yeah, so all the kind of those day-to-day functions of our pelvis. Oh, support. That's my last S.
That's okay. That happens to me all the time. Anytime I have a list, anytime I have a list to remember, like say the list is like of 5 things, I always get through 4 and I have the hardest time with that last one. Like no matter what it is.
So, I mean, if you think about the bony pelvis, it's a ring of bone. And then if we have our pelvic organs in there. So if we didn't have that muscular support underneath, everything would literally just drop through the bottom. So those muscles have to work all day, every day to hold everything up and in. So sometimes there can be what's called prolapse, where those organs are starting to shift down a little bit, maybe protrude into the vaginal canal. And again, it's very much more common related to pregnancy and childbirth, but there are some women who have that without experiencing childbirth yet.
Interesting. Okay, so 4 S's.
4 S's.
Sphincter control, sexual health without pain, pain-free, stability, and support. So all of those are super, super important. I do think it's interesting, definitely like with the stability, like you mentioned, low back pain, hip pain, that maybe you wouldn't think that it's related to this, So I thought that was interesting for sure. Tell me if someone is experiencing any of these things, and they find their way to you. So first of all, how do people find their way to you? Is it typically through a referral from their primary physician, from their, since we are focusing on women's health, through their gynecologist, or just kind of they realize this on their own and kind of Google search you? Like, what are the most common ways that people do find you?
It's getting to be more and more common of just direct someone coming to me, you know? So yes, there is that referral component. But yeah, more and more women are kind of taking their health in their own hands. Pelvic health has sort of thrived under social media of just getting that information out to women and being like, wait a minute, I don't have to be dealing with this. Let me do something different. And then they start searching. So I probably get more of my patients through just they're doing their research online. They've had a friend who's done pelvic health and they're like, I need that too in my life. But it could be either.
Okay, great. And I mean, I think that just underscores the importance of having conversations like this, so that as women, we can start to have these conversations with each other, even with our friends. Hey, you know, oh, did you need this too?
Yeah.
Okay, well, what did that look like for you? Who did you go see? Right? Just having more and more of these conversations. So I think that just underscores the importance of that, especially as, you know, as physicians in our offices, we just have limited time, just with the way our health system is set up. We just have limited time as well, to maybe go into as much detail as well. And so having that information out there and having that information from reputable sources as well, which is really important to me, as well as I'm inviting guests on this show, and why I wanted to invite you as well to speak on this. So once someone finds their way to you, what does your work together look like in terms of, is there an initial assessment, and then what do, you know, ongoing treatment plans and management plans generally look like? Now, I know obviously we just went through you take care of and you treat and you help people manage a variety of conditions. So I know that plan is going to look different for everybody, but can you give us just a general overview of what that would look like? Because you know, I think for many of us, a lot of things, and especially when it's related to our health, our pelvic health, and all of the things that go on down there, as well as, I mean, with anything with our body, even something as, you know, maybe not as sensitive, right, can feel scary to have to go get some sort of treatment or management. And so I think just kind of having an idea of what that looks like, just to kind of help reduce any fears or anxieties around what that would look like. Quick shout out to today's sponsor, Reclaim Your Radiance, Radiant Living Institute's signature coaching program designed to help you reclaim your worth, renew your energy, and restore your happiness in your life, career, and relationships. This 6-module curriculum has already helped countless women rediscover themselves through life's storms. From setting difficult boundaries within toxic relationships, to finding their inner strength and power while navigating divorce and co-parenting, to aligning their career and business with their authentic self, and to learning how to live for themselves again after their kids have left the nest. This program has been a guiding force for women to live unapologetically and shine brightly within their lives once again, or often, even for the first time ever. Experience the results for yourself. Head over to radiantlivinginstitute.com/reclaim-your-radiance to learn more and get started.
Absolutely. So of course the treatment answer is always it depends, you know, but in terms of the, you know, initial assessment, those first, you know, few weeks, things like that, it always starts with a lot of history taking, of course. And I kind of laugh. Most people are like, this might be too much information. I'm like, literally everything I'm going to ask you is too much information. And then you're going to say one thing. I'm not going to have like a couple follow-up questions on that. But what's living in my head, again, is kind of that musculoskeletal system. And usually I'm holding my model in my hand as I'm saying, like, this is what I'm thinking about. I'm not thinking about these other things as you're describing them. But so very, very thorough history, you know, figuring out what the complaints are, how long they've been happening, but also asking more about, you know, urinary bladder function, asking about bowel function, asking about sexual function, all of those different components, because someone might not feel like they're related, but they're all living in the same neighborhood. So really, really thorough discussion of all those pieces of it. And then the pelvis doesn't operate in isolation. It's sort of grand central station in our body, connecting trunk to lower limbs, up, down. So I'm usually looking at posture first. I'm usually looking at just the movement of the back. Can you squat? Can you lunge? What does all of that look like? What's even the position of your feet? Are they, slouched in on your arches? Are they a little bit more neutral? Because all that's going to give me information of what is impacting the pelvis. And then certainly what the main thing people are worried about is potentially that pelvic assessment, that internal assessment. So for most women, our only experience is a gynecological assessment. And how I kind of explain it is, the gynecologist has to get through the muscles to get to deeper layers to make sure there's not major big things, wrong with the pelvic organs. Whereas what we're looking at is those muscles. So we can take it one layer at a time, one step at a time. And if the first layer, there's 3 layers of muscles. If the first layer is saying, nope, no entry, you are not welcome here, that's where our therapy starts. So there's no stirrups, there's no speculum. I kind of laugh, it's me in a glove. So yeah, we can kind of start with that. And I've even had some patients where we never even get to that pelvic assessment via the vaginal canal for a while because our therapy has to start even less layers than that, even just getting used to touch of someone else. So it all depends even with that assessment. But if there was nothing holding us back, if we got through everything on the checklist, it'd be posture, body mechanics, you're looking at the alignment of the spine and the pelvis, looking at those muscle layers, how they're reacting, their strength, their coordination. Can they relax? Because that's sometimes hard for people. They are really good at contracting up and then they just live there. And checking for any tenderness. So just like you can have a knot and a tender spot in your neck or your back or your shoulders, same thing with those pelvic muscles. So that's all those kind of big picture components of the first assessment. And then certainly depending on what's going on, what we're finding will dictate that treatment. But it's a lot of stretches. It's a lot of breathing exercises. It's sometimes strengthening, but not just Kegel squeeze, Kegel squeeze, Kegel squeeze. That's very isolated. We're wanting to integrate those pelvic muscles into the whole body system. So again, it looks a lot of different ways.
Yeah. I think that's interesting because, a lot of people know, okay, Kegels,
just
right?
Kegels, 10,000 Kegels a day and you'll be great.
Right. And I know that you brought in a model as well. Maybe we could, maybe you could show that to us.
So if you guys are watching us on YouTube, or if you're not, go log into YouTube so you see the lovely pelvis model.
Just to see kind of like the different layers and all that is involved, right? And so that there really is a lot more to it that seeking a specialist such as Meghan to help you with, or if you're like at home and you're like, well, I've tried the Kegels, isn't that all that they can do? Well, no, there's a lot. There's a lot more. And so maybe you can kind of go through that a little bit with us.
Absolutely. So, basically what I always kind of say is like everything that you see in red here are muscles. And again, we don't really appreciate how vast, but basically all those muscles attached from front to back, side to side, and here from the bottom view, all of those muscles there. And there's even some deep hip muscles within the pelvic floor. So sometimes, again, if you're having a hip issue, there's a muscle that kind of hooks around through here and attaches deep in the pelvic floor. So again, I would kind of, start externally, assessing to see if there's any tension through here, looking through the perineal area, if there's any tailbone issues. Almost every muscle through the pelvic floor attaches to the coccyx, whether directly or indirectly. So again, you kind of have to appreciate all those different pieces of it. But essentially for the layers, we kind of say it's like one knuckle at a time for those 3 layers. So the first 2 are kind of that vaginal canal, that vaginal opening, and then it opens up, if you can kind of see, almost like a bowl. So sometimes people will use the analogy of like a stemmed wine glass. So the stem is kind of the vaginal canal, and then that bowl of all the rest of those muscles. But we can assess and treat through all the tension in any of those muscles in any of the layers.
Well, that's great. Thank you so much. I think it's helpful, always helpful, just to kind of see that model there as well and for describing that to us. And so I'm curious, as we're kind of starting to wrap up our conversation, I would love to know what are some of the results, positive results, benefits that you have seen as a result of clients working with you?
Yeah. So again, as widespread as there are issues, but I've worked with some women who have never been able to have penetrative intercourse, never been able to use a tampon, never even been able to do a gynecological exam. And we're able to work through that and allow for that insertion or penetration to occur. So they're all of a sudden able to consummate their marriage that they've never been able to. So, or experience, maybe they used to have sex without pain, but now they're having pain and we're able to get them again pain free. Again, those, urinary, sometimes also fecal control, being able to control their bowel movements, but alleviating constipation, alleviating leakage. With that, you can sneeze or cough. I even had a client recently being like, we were caught in a major windstorm and all my luggage all of a sudden went blowing away. So I had to throw the kids in the car and full on sprint. So she was able to, get back to running and activity. And she's like, a couple months ago, I would have been leaking everywhere with that. So those, types of pieces, even sitting. So if you have tailbone pain, that coccyx pain, you can't even sit on a chair comfortably. So even just being able to sit comfortably, it's kind of widespread, those results. But always the goal is kind of, symptom free or symptom well managed. So of course there are some conditions like endometriosis that I'm not going to take away that, but I can help resolve a lot of the other things that get caught up in that. And so if we now just have one source of pain instead of 10 sources of pain, all of a sudden that thing that I can't take away becomes so much more manageable. So again, there's a lot of different components to managing pain, dysfunction, control through the pelvis.
Yeah, absolutely. I know I asked you to come on and talk about a really big topic with lots of different details. But I think this has been really helpful. And I hope this has been really helpful for our listeners. I know I learned a lot through it and gained some valuable insights. And I think one of the biggest takeaways that I would love our listeners to have from this conversation is just an awareness that this modality of specialized care does exist. And I think so often, many of the women that I work with, Meghan, are just very busy, high achieving women, juggling all the things, motherhood, relationships, family, many in the sandwich generation, so taking care of their kids as well as their parents, as well as working full time, all of the things, right? And I think, it can be so easy to, when you're experiencing any symptoms, try just kind of put it on the back burner. Okay, I'll deal with that later. I'll deal with that later, and keep putting it off. And then especially when it is related to things of that feel more personal, more private, more vulnerable. Exactly. And so knowing that these resources are available to you, and knowing that hopefully this conversation helps to also empower you to be an advocate for your own health and well-being, and to not delay scheduling that visit anymore. And so it sounds like at times you may need a referral, but at other times you don't need a referral as well, and you can kind of come directly to you.
In terms of legality, so I practice in Virginia, so you can come directly to physical therapy. The only weird place that you might require a referral is if like your insurance company requires that for, anything. So that's not necessary. But yeah, you're right. Like we're all so busy, and exactly what you always preach of like, who has time for self-care? We need to make time for that. But sometimes, again, these very vulnerable personal things, and that's sort of a burden that you're carrying, and you don't want people to know that you have to wear pads every day or, things like that. And then if you can alleviate that, man, that's a big burden off your chest to be able to face work and life and balance. So it does help.
Absolutely. And so that being said, obviously, check with your state, check with your insurance with regards to kind of how you can access these services the best for you with regards to where you are. But for those of my listeners who are here in Virginia, who are in Hampton Roads, how can they learn more about the work that you're doing? If someone is listening and is like, that's me, I'm experiencing some of these, and I want to work with you, like how can they find you?
Yeah. So you can certainly go to my clinic's website is movementistmedicinept.com. And those I think will all be in the show notes too if I misspeak on any of it. And then I'm also on Instagram where I try to put a lot of just like tidbits, a little bit of educational content. And that on Instagram is mkarol.dpt, and Carol is spelled with a K. So that's MKAROL.dpt.
Wonderful. And yes, I will definitely be including all of that information in the show notes. Thanks again for being here.
Thank you for having me.
Thanks for tuning in to this episode of the Essential Self-Care Podcast. If you like what you heard, be sure to subscribe, leave a positive review, and share this episode with someone you know. And remember, your free guide, 6 simple yet powerful steps to create your radiant life, is waiting for you at radiantlivinginstitute.com. Download it today.